the housing. Hello. Our policy is the housing first policy, and we termed that a humanizing policy. And we all felt and agreed that this was something we were passionate about because we read the book Evicted. Oops. So we wanted to start our presentation off with a quote from the book we read, and that is, "Decent, affordable housing should be a basic right for everybody in this country. The reason is simple. Without stable shelter, everything else falls apart."
Okay, what is Housing First? Housing First is an approach that prioritizes permanent housing to people experiencing homelessness, thus ending their homelessness and serving as a platform from which they can pursue personal goals and improve the quality of life. This approach is guided by the belief that people need basic necessities like food and a place to live before attending to anything less critical, such as getting a job, budgeting property, or attending to substance use issues. Next, how is Housing First different from other approaches? Housing First does not require people experiencing homelessness to address their problems before they can access housing, including behavioral health problems or graduating through a series of services programs. Housing First does not mandate participation in services either before obtaining housing or in order to retain housing. Supporting services are offered to assist with housing stability and individual well-being. Other approaches do make such requirements in order for a person to obtain and retain housing. Next, who can be helped by Housing First? A Housing First approach can benefit both homeless families and individuals with any degree of service needs. Housing First also promotes racial equity in that it removes judgment from the providers as to who is deserving of permanent housing, which can be riddled with bias against people of color. Housing First approach can be applied to help end homelessness for a household who became homeless due to a temporary personal or financial crisis and has limited service needs. Next.
Okay, I'm going to be covering the problem statement with Housing First. Housing First raises issues of cost, sustainability, access to resources, and a supportive infrastructure, and the capacity to house all those who are in need. It was introduced in 2005 with the goal of ending homelessness in Utah by 2015. And Utah received a lot of recognition for their efforts and success on this front, and many other states began modeling their programs after ours. So although we were lauded for reducing chronic homelessness by 91%, homelessness is still a very prevalent and complex issue in our state, with numbers increasing since 2017. So let's go to the next slide. So this is a graph of Utah's chronic homeless individuals from 2005 to 2022, taken from HUD. And you can see here that between 2009 and 2010, there's this dramatic drop in the number of chronic homeless individuals. And part of that is due to, that was when Utah decided to change their definition of chronic homelessness. So before 2009, we were including people in transitional housing. And after 2009, they started not including those people. So while there was a decrease, it wasn't quite as dramatic as it shows here on this graph. Now, chronic homelessness is defined as being homeless for a year or more, or having experienced 4 or more episodes of homelessness in the past 3 years. It also includes having a disabling condition, such as a serious mental illness, substance use disorder, or chronic health condition. So in a more fair analysis, I read that if you're accounting for this change in methodology and definition of chronic homelessness, Utah did decrease homelessness by about 71% during that decade. Also, a great statistic to note is that in 2022, 95% of those who were enrolled in permanent housing through Housing First retained their permanent housing at their 12-month mark. So people are staying in their housing, and state officials agreed that Housing First offers compassion and data-driven proof that individuals remain housed and become able to address their individual barriers through this program. But the low turnover and people leaving their houses accommodations raises issues of cost and sustainability. Joseph Jensen, who oversees the data collection and management of Utah Homeless First services, cites that the tightening of the housing market, very low vacancy rates, and that housing and rental prices have increased so dramatically makes Housing First so much more expensive and the need for it so much greater. Housing in Utah costs roughly twice as much as it did in 2015. So even though we keep increasing our spending on homeless services, our homeless numbers keep continuing to rise. Next slide. Okay, so the reasons why social workers should be addressing this issue is that we're often on the front lines of homeless outreach, engagement, assessment and referral, advocacy, and community organizing. It's often social workers that are building trustworthy relationships and rapport with homeless individuals. We're connecting them to resources and services depending on their individual needs. We're helping them make goals. We're helping them navigate through systems and paperwork that can be very complicated. And then we're also that person to policy connection where we can advocate for changes on state, local, and federal levels. Next slide.
My position, and I think most of the position of our group, is that we believe in the Housing First approach, and for people are experiencing homelessness for a number of situations. As stated before, many suffer from mental illness, substance use disorder, and some just because of inflation in the housing market. There are many more reasons, and the individuals that are suffering for a number of other things cannot begin to heal or get on top of their own personal goals because they are in houses, has been stated earlier. If you're required to have a job first or to be sober, the cards are stacked against you, and it's difficult and in some cases impossible for individuals to hold a job when they don't have a place to shower or a place to keep your belongings. For the same reasons, it's very difficult to get sober when you don't have housing. If you're housed, you stand a much better chance of being able to avoid the people and the situations that often may have been the catalyst to your addiction. While Housing First is based on a client choice, which I strongly believe in, forcing people has not always been very effective, or it will be effective for a short time, but not sustainably. There needs to be some accountability on behalf of those receiving the housing. The National Alliance to End Homelessness states, thus ending their homelessness and serving as a platform from which they can pursue personal goals and improve their quality of life. If we're not following up to see that individuals are progressing and that they're doing those things, being in a position to be able to pursue their personal goals, then I believe we will be wasting our money in some cases. The social work's mission and values, as stated in Social Work Today, says that the values articulated in the Nassau Code of Ethics are to work with and on behalf of the most disadvantaged and vulnerable among us, seeking to enhance their self-determination, autonomy, and well-being. It is clear that Housing First is a preferable option that embraces a coordinated system of care at the micro, meso, and macro practice levels. Social studies show that when people are experiencing homelessness and are given safe, stable, affordable housing, they're better able to address their problems and needs, such as substance use disorders, mental illness. As a result, homelessness, frequent use of hospital emergency departments, and psychiatric hospitalizations are reduced. The public view of our position is, with the general overview of housing, the public is in favor. However, if you dig down into the depths of the cost, there may be fiscally conservative people who disagree. I find in our state, most people agree. However, there are individuals that find homelessness and circumstances surrounding it as a moral failure. And we tend to be a punitive state here in Utah. What's the current state? Allison mentioned a lot of the things that are Utah's current state. Even though Utah is at the forefront of Housing First. There and likely elsewhere in Utah, the lack of housing there's just a lack of housing. Housing's not available. There are companies and individuals working on ideas that are outside of the box, such as the Other Side Village with tiny homes. It would be wonderful if we could find a wealthy philanthropist that would convert vacant hotels into clean, livable, supported facilities that would house many more individuals. I'm aware there are lots of problems that arise in those circumstances, but I think it would take someone who would be willing to not try to get the biggest bang out of their buck or the most out of their investment. There's simply not enough housing in Utah, and it's not available, and it's very expensive. If I owned rental units myself, I would want to get the most out of my investment. Implications and potential unintended consequences of this is, and Ashley will touch on this more, but there's been some research that has shown that substance use disorder overdoses skyrocketed when San Francisco did Housing First. They were not in places where they were alone and people couldn't administer naloxone to them. Also, I think that another unintended consequence are individuals that had not been experiencing chronic homelessness became homeless to save money. The homeless rate actually went up in some cases, and that depends on your definition. There's also corruption with developers. Once people see, oh, the government's going to pay you to build these buildings, they end up costing more than they were initially, and they get the bids, and then the cost ends up skyrocketing. I think it's important to really vet who would be awarded the contracts for building the housing. And last of all, I believe it's important to follow up on individuals and make sure they're progressing. If they're not progressing, they would need to be transferred to some other type of supported system that could help treat them so that they could free up a housing that could be offered to another individual. Next. Ashley, you're on.
As far as the counter position goes, one of the arguments is that Housing First doesn't actually treat the root cause of homelessness, which is mental illness and addiction. In fact, it stacks people with these issues into small living quarters where they can feed into those addictions. A personal example I saw of this was when I was living in California and they were doing Housing First, which they called Home Key. And I had an associate named Kevin, we'll name him Kevin, that I was working with, who, our first, he struggled with an addiction to drugs. And our biggest goal working with him was to get him into stabilized housing. So once we got him into housing, he was there for a month before he chose to leave and continue sleeping on a park bench. The reason for this was because he wasn't able to beat or to overcome his addictions living in these close quarters with people who were fighting the same addictions. They kind of fed into his addiction. So instead of staying in the Housing First program, he chose to leave. In an NPR article I read about Housing First, and this was used as a pro for Housing First, this statement, it was said, the idea of Housing First is that housing comes first and services come later. To me, this sounds like, what comes first, the chicken or the egg? They need to come together. I mean, Housing First, and services need to be hand in hand. Without housing, people can't be successful in overcoming addictions and receiving services for mental illness. But with just housing and not taking care of those services at the same time, they're not going to be able to overcome them as well. And this is because programs are poorly managed. So many do prefer to live on the street or are just not receiving the help and the services that they need within the Housing First program. And then something that Tina brought up briefly is that it does attract outsiders who are drawn to the promise of permanent and usually rent-free room. So this could increase homelessness. And they did see this in California while they've been working on their home key project. So, and then according to that graph, Utah has possibly been seeing that as well. Next slide.
Okay, so in light of, you know, all of these things that we've been discussing, I think that we kind of agreed that as social workers, we are always seeking for the ideal solution, and that doesn't really exist. And whatever program is out there is not going to impact everyone equally, and everybody's not going to take advantage of it in the same way. So Housing First is making a lot of strides, and there's a lot of positives. So it's definitely a program that I feel like should stay on the table and just constantly have tweaking and adjusting. So our future compromises focus on two pieces, promoting self-sufficiency and reducing the cost of housing. A lot of opponents to Housing First often cite the lack of self-sufficiency that the program creates, because you see a lot of people staying in the housing and just not moving on. So when I was doing research on the HUD website, they've done a lot of studies, and they've shown that the idea that those people that are in permanent supportive housing don't want to leave, that's been proven a myth. But when there's not affordable housing to move into and other resources that aren't available, the challenges are often too great for them to move on. So within promoting self-sufficiency, this program was audited back in 2021, and this quote on here from the auditors of that program said, because few residents move on to more independent forms of housing, few new spaces are made available in the existing facilities. Unless this trend can be reversed through a moving on strategy, the growing population of chronically homeless will impose an ever-growing burden on Utah's homeless services system. And we see this as COVID exacerbates the problem and just creates a lot more homeless individuals and families. So HUD actually on their website has a program set up to help communities with moving on strategies. They have webinars set up and case studies and information to help communities implement strategies to help individuals. So I think that using those resources that are already out there is a great way to start this. And also HUD vouchers. So in our book, Evicted, the author mentioned that 1 in 5 families in the United States pays 50% or more of their income for housing, which is just so difficult. And so there are some voucher programs where families that fall in low income categories will only have to pay 30% of their income for housing, and the government subsidizes the rest. There are improvements that need to be made to that program, and it needs to become more universal. I've wondered too about the possibility of having a sliding scale, because a lot of times families will keep their incomes low in order to stay on the program, and it promotes like living under that level instead of striving for something better. So just tweaking the housing voucher program would help a lot with that.
We also, for our future compromise, think that reducing the cost of housing in the state of Utah, but as a country as a whole, would make a big difference. And we've talked about that, I think, in every section, that the cost of housing is one of the largest barriers to finding housing, especially safe housing. We learned a lot from the book Evicted, that even when people are able to find housing, a lot of times it's not suitable for living. To eventually get out of provided housing, our country needs to work on making housing more affordable. And we think 2 unique ways that this is attainable is through out of the box solutions, as well as rent control laws. So we have a quote here that says, sorry, despite initial progress, the number of Utahns experiencing homelessness has since risen sharply. In 2022, an estimated 3,500 state residents were experiencing homelessness, an almost 25% increase since 2018. During this period, the number of unsheltered Utahns doubled. The increase in homelessness rates have been attributed primarily to a rapidly increase in home housing prices with the COVID-19 pandemic, which the COVID-19 pandemic made worse. And I think we've all felt that. I know that my rent is increasing too. So the ways that we think we can compromise and combat that is thinking of outside of the box solutions, which were mentioned, such as tiny homes. Many cities have found with large homeless populations that this has been effective and will help areas with a lack of housing. It is important to mention, though, that we need to make sure that these tiny homes and new forms of housing are adequate and not stacked on top of each other, and don't increase risk of use, drug use. In the book Evicted, there was the solution of making sure that housing was spread out throughout the city so that everybody was getting different like resources and access to different schools. And I think that would be a really important part of this solution of creating more housing, is making sure that it's spread out and not all in one place. The second part of our solution for reducing the cost of housing is rent control laws. Currently in Utah, there are no rent control laws, which makes it so that landlords can increase the rent as much as they want, as well as like continual increases. There's no limit on that. And so we would advocate for creating laws that prevented that. In the book Evicted, we saw time and time again, multiple landlords who continue to increase the rent, especially if people were using the HUD vouchers. But overall, we believe in the future compromises and that they're possible. And the Housing First policy is a humanizing one that puts people first. We also have provided a list of our references from everything that we read, and they're all linked here so that you can access them.
Okay,
That's
you guys, I think we did good. I think that was
Do you
excellent.
want to end the recording?
I did already.
Oh, it says it's still recording on mine. That's why I was thinking that.
Yeah, I know that we can clip it though, so that will
I
be
got the recording. I paused.
Yay!
I guess I paused it. Okay.
I definitely
Yes.
I said